what is cataract?
Slowly, the patient will start losing the quality of vision.
66 to 71% of the vision loss.
That may be a sedentary lifestyle, consuming a lot of sugars.
How can a person identify that they are having this disease? Is it painful?
So diabetes is one of the most leading factor for the occurrence of early cataracts.
There is no eye drops, there is no eye ointment.
There is also one more set of population where they are affected even at birth.
Jai Shri Gurudev. Namaste and welcome to BGSMCH Aarogya Vani. Your health, our priority. I am your host, Dr. Anu Mohandas, Associate Professor, Department of Community Medicine, and we are delighted to have you all join us in this show where we bring expert insights to help you stay informed and stay healthy. Have you ever felt that there is a gradual change in the quality of vision? As if you are looking through a smudged glasses. The colors becoming dull. Even reading your favorite book feels like a struggle. Looking at a light gives you an annoying glare. These are the realities of cataract, one of the most common cause of vision loss worldwide. Despite being this common, there is a lot of myths and misconceptions around cataract. To make us understand about this disease better, we have with us today our expert from BGS Medical College Hospital, Dr. Spurti, Associate Professor, Department of Ophthalmology. Hello and welcome to Aarogya Vani, Dr. Spurti.
Jai Shri Gurudev, Dr. Anu, thank you for having me in this show.
Jai Shri Gurudev. Dr. Spurti, cataract is so common and given a long enough life, every person might come across this disease at some point of time. Can you please explain to us what is cataract and how does this disease progress according to the age?
So now most of us know cataract is an age-related disease. Most of the aged people get cataract. You might have heard people telling my grandmother is having cataract, they underwent surgery. So in the eye can be compared to a camera, and there are different layers even in the eye. The eye has an anteriormost part, that is the cornea, and then comes the lens inside. The light passes through the cornea and lens, and finally the light reaches the retina. This is how the brain interprets the images. Through retina, the images are passed on to the brain. So the clarity of the cornea and lens is of utmost importance. So in cataract, what happens? The part that is the lens, what we call as, that part gets blurred or opacified. So because of that, slowly the patient will start losing the quality of vision. There is a reduction and there is a scatter in the light, and all the light what is entering into the eye is not able to reach the retina. Hence the patient will slowly develop a blurring in vision.
So from what you explained, we understood that the lens that is supposed to transmit the light rays to the retina is getting opaque. So that is the reason why cataract is caused.
Yes.
How does the progression in age cause this disease?
Like when we age, there is graying of hairs. So there are a lot of changes, metabolic changes happening along with the age. Lens is nothing but a group of proteins, and it is composed of so many types of proteins, so which is slightly of low density when we are born. As we age, the proteins also change. It's just a physiological change in the lens, added by our lifestyle changes, where the proteins will change their structure eventually, and that itself causes the opacity of the lens.
So degeneration of the naturally occurring proteins in the lens,
yes,
is causing the cataract.
Yes.
According to the age.
Yes.
Now you specified about the lifestyle factors as well. Can you specifically mention what are the lifestyle factors that can aid on to the progression of cataract?
Cataract is an age-related problem, but some might get at 60, some might get at 80. There is no fixed that, yes, at this particular age, I'm going to get cataract. That is not fixed. But with lifestyle certain lifestyles, they are more prone for getting cataract around in the early 60s to early 70s. That may be sedentary lifestyle, consuming a lot of sugars, or more of sunlight exposure. These are the common factors that cause, progression early. Presence of even comorbidities can be a contributing factor.
So now we know that, like any other lifestyle diseases like diabetes, hypertension, even the sedentary lifestyle and the diet is also having an impact on the cataract. Okay. So other than this, recently one report, National Blindness and Visual Impairment report that came in 2019, the stats said that 66 to 71% of the vision loss above 50 years is due to cataract.
Yes.
But the interesting finding was that among those below 50 years, also the visual impairment, 25% of the visual impairment was contributed by cataract. So does it mean that cataract can happen in younger age group as well?
Definitely. Cataract can even affect the younger age group. With the lifestyle modification, like increasing incidence of diabetes, even the cataract incidence among the diabetics have increased. So diabetes is one of the most leading factor for the occurrence of early cataracts, that is below the age of 40. Other factors such as a trauma, maybe a blunt trauma or even penetrating trauma, can lead to opacification years after the trauma has occurred. There are other metabolic factors also that contribute to the disease. Very few percentage like eye inflammations, some infection or inflammation inside the eye can also lead to cataract. So basically, if there is any interruption in the nutrition of the lens due to any infection or inflammation, this can lead to cataract formation even in the young.
So many might be aware that in old age cataract can happen. Now this is a new information that even in young age, if they are diabetic, if there is any eye injury that they have encountered any time in their life, or any other, some rare other factors like metabolic disorders and all, can contribute to cataract, right?
There is also one more set of population where they are affected even at birth. That is called as congenital cataracts. Though it is rare, we screen usually babies for such problems at the time of birth, especially if the mother has had some infections when the mother is pregnant during the first trimester. There is a high chances of the child having cataracts.
So if babies are having cataract, they would be already knowing about it because eye screening has been already done in the hospitals.
Yes.
Okay. How prevalent is this congenital cataract?
Now with the increase in the sanitation and the incidence of infections, perinatal care has drastically improved. The maternal nutrition has drastically improved. So previously the incidence was high, but now we can happily tell the incidence has come lower, but still it's not totally zero.
Okay, so even congenital cataract has causative agents related to sanitation and other infections.
Definitely, any infections during the first trimester, especially for example rubella. Okay. So they can go in for such, the child can come be born with cataracts or develop over a period of time. Even traumatic deliveries can lead to cataract formation.
What are the symptoms of cataract? How can a person identify that they are having this disease? Is it painful?
Okay, most of the patients who come to us with mainly they complain of blurring of vision, and this will be over a period of time. It doesn't happen in a day or two. They tell recent changes in the vision, the drop in the quality of vision, and especially when they go for during the daylight, during the sunlight, they feel the image is dull and the image is scattered, and they will have glare. Drivers mostly experience during the night time when they are driving, they'll have glare. They are not able to see the light so clearly, or they'll not be able to tolerate the light, excessive light coming from the opposite side. That's when they experience this kind of situation, and they come to us and they get it checked. and very few percentage of patients they come with pain. They will have blurring of vision or loss of vision from the beginning, and now sometimes what happens, there is swelling in the lens. The lens can swell up to an extent that it can increase the eye pressure. That is a very small amount of population that presents like that. But if it's neglected, the cataract is neglected for a long time, or they are having diabetes, uncontrolled diabetes, where there is a chance of lens swelling, so this can lead to increased intraocular pressure and they can come with pain. But this pain is very rare. If there are 100 patients with cataract, this type of painful cataracts are only 1 or 2. So it is very rare. The most common presentation is gradual painless loss of vision. The patient's visual quality will be affected gradually, and driving the things which he does with precision, like for example driving, will be a difficulty for the patient.
Pain is a symptom that usually brings a patient to the hospital. And this disease is tricky because it doesn't have pain. But there is a gradual loss in the quality of vision.
Yes.
And might be their day-to-day activities. If it is a driver, he might feel it more disturbing because it is affecting his daily occupation.
Yes.
Okay. So if a patient presents to you with all these stated symptoms, how do you diagnose this illness?
So it can be done with a simple eye examination. We just do a basic preliminary eye examination, then put dilating drops. We dilate the pupil, and we can see the opacity right then and there. There is no need of any investigations like any X-ray or anything to diagnose. It just takes a few minutes with your ophthalmologist. We examine, and we also grade the nucleus of the what is the grade of the cataract, what is the extent of the cataract. That can be all examined within 10 minutes.
So there is no So there is no requirement of any costly, expensive lab investigations or radiological investigation for diagnosing this illness. It's a simple eye examination by an ophthalmologist that is only needed.
Yes.
Okay. What are the treatment options available for this disease?
So now, with the advent of newer machines and newer operative techniques, we have basically two important techniques. Previously, we used to do something called as manual small incision cataract surgery. Now, with the advances, we also have phacoemulsification. So it's a simple procedure where we open around 2 millimeter to 3 millimeter and we emulsify the nucleus with the help of a machine called as phaco. So here ultrasonic probe is put inside, in bits and pieces the cataract is cleaned, and then we introduce the artificial lens inside the eye. So removing the opaque lens and introducing the artificial lens is the crux of the surgery.
Okay, what I could understand is that cataract surgery is the only treatment available for cataract as of now.
Yes.
But being a community medicine faculty, when we go to field, we have seen people using eye drops for cataract. So what is your take on that, Dr. Spurti? Is there any effective eye drops, or for that case, eye massage or eye exercise curative for cataract?
Yes. So contrary to the belief, there is only option available is surgery. The eye massages or the exercises or drops or ointments cannot reverse the already progressed changes in the lens. So the many studies have shown that these changes, the opacification, what happens, they are irreversible. Okay, and that can be cleared only with the help of surgery. Even if I just clear the opacified lens is not enough, we need to replace the original lens with the another lens. That can be introduced only with the help of a surgery.
So cataract surgery is the only treatment that is available for cataract. There is no eye drops, there is no eye ointment that can cure cataract. When it comes to surgical treatment, people get worried, especially surgery, and that too about eye.
Yes.
No? So can you please walk into the surgical steps in a cataract surgery? How you are cutting open the eye? Is there an anesthesia that you are providing? Is it risky?
So I tell my patients now that it's just like jokingly we tell that it's just like getting a haircut done. So it's that simple, that convenient, and we have all the modern equipments now available that has made even the surgeon's life easy, and easy for the patients to come get it done and go. Basically, cataract is a daycare procedure. You come, you get it done in the morning, you can walk out within 15 to 20 minutes, the procedure is done. You can walk out the same day. And now there are advances where you can even do it with only eye drops. Anesthetic eye drops are put, and then we go on with the cataract surgery without any pain. So there is no need of any anesthesia, there is no need of any injections around the eye, there is no pain basically. So the advances are so much so that it has helped the patient as well as it has helped the doctor. Regarding the duration, I told you there are two types. So both the types, you can just finish off the entire procedure within 15 to 20 minutes maximum. And next day, the patient will not even patch the eye. We'll just put the eyeglasses for the protection, and we'll just send the patient on the same day. Patient can talk during the procedure. He will be knowing what is happening in and around. We'll just ask the patient to focus towards the light, see towards the light, and the things are done. So the size of the incision is so small now with the phaco, what we are doing, it is around 3 millimeters. So it doesn't cause any kind of pain. And we are using topical drops, topical lignocaine drops or anesthetic drops we are using, so that the patient will not feel any injection pain or anything. So it's that very simple nowadays.
Okay, I like that analogy. It is similar to a haircut. A haircut takes more than an hour now, and this cataract surgery is just taking 15 to 20 minutes.
It's like you walk in and come, you know what is going on inside, you walk and go out on the same day. There's no admission, there's no prolonged stay in the hospital, there's very minimal inconvenience for the patient.
But how about the recovery post-surgery? How long it will take? Is there any precautions that the patients should be taking so that there won't be any complications post-surgery?
After the surgery is done, we advise the patient to come day after the surgery, after a week of surgery, and at the end of 1 month. So after the surgery, they have to see to it that their eyes are totally clean, and they have to use the prescribed drops time to time. So that is of the utmost importance, and the drops has to be put by another person, and they have to ensure proper cleanliness, washing the hands, and even the patient has to ensure he is washing the hands, and utmost care with the cleanliness is very important, because any post-operative infections, though rare, it's very disastrous for the eye. So the care should be taken that he or she puts the eye drops regularly, keeps it with utmost hygienic conditions. We also tell them not to use any kerchiefs or any tissue paper. They think when they open the packet, it's a new tissue paper, but no, they are not sterile for the eye. So there are separate wipes available only for the eye, even if they want to wipe the eye. We also ask them not to do any shaving or not to take any head bath for a week time, so that the eye healing will be proper. We also advise them to use the goggles every day, even at home, inside the home, so that accidentally or anything they don't touch the eye and they don't cause any disturbance in the eye. So these are the common precautions they need to take. And at the end of 1 week, we call them for follow-up. So the healing is done around 50 to 60% healing is already done. The first week is crucial for the healing, following which for another 15 days to 1 month, they need to be careful. They need to not lift heavy weights. They need to, take care again of the hygiene. So these are the common precautions they have to follow. And at the end of 1 month, we will prescribe the glasses if required, and then they can resume their daily activities like usual.
So that means to say that after 1 month, they can resume their regular physical activities.
Yes.
You mean to say even cooking, walking around, seeing TV, using mobile phones, is it also that they have to delay it for 1 month?
No. We advise them to do it in moderation with the use of the safety goggles. So walking, since they have to go outside, they have to be again careful of any kind of foreign body falling into the eye or some sand particle or something falling into the eye. They have to use the goggles. And cooking, the fumes might affect the eye. So initial at least 3-4 days we advise them to take bed rest. Later, after a few days, they can resume, maybe like after 1 week, they can resume along with the goggles, safety goggles.
Okay, at least with care for 1 month.
Yes.
In moderation.
Yes.
Whatever daily activities that they usually do,
Yes.
also in
Yes.
moderation for 1 month, and post 1 month after consultation with an ophthalmologist, they can be back to their normal routine.
Yes. Strenuous exercises and lifting heavy weights and going upstairs or downstairs, going to the gym, all these cannot be done during that month. We have to just avoid those things. Smaller activities like walking or anything along with the goggles is advisable.
Okay, so what about patients who are at a higher risk, having diseases like diabetes, cardiac problems? Do you do cataract surgery for them as well?
So age-related problems like hypertension, cardiac diseases are common because our patients are mostly around 60 and above. They already have so many of problems. So their worry will be, what will happen to me if I have uncontrolled BP, or my cardiac disease condition is this, stenting has happened. I have had heart attacks multiple times. So can I get it done? Absolutely yes, because since we are doing it under topical anesthesia, there is no much absorbance of the anesthesia or the drug into the systemic condition. Yes, but we take the precaution during the surgery that their BP and their blood sugars are under control. That is of utmost importance. If the BP is uncontrolled, then we might have disturbances during the surgery. So we advise them to talk to their physician regarding their condition after a physician fitness, and also if required we ask the anesthetist standby. Anesthetist also examine them and they stand next to us during the surgery so that there is no untoward events happening. Even if the patient is tensed or the BP is elevated perioperatively, the anesthetist will manage accordingly, and then we will go ahead with the surgery.
Okay, so for those people who are diabetic, cardiac problems also, you can safely do a cataract surgery.
Definitely.
Okay. While explaining the whole process of cataract surgery, you explained about replacing a natural lens and putting in an artificial lens. What are the varieties of intraocular lenses that are available?
Yes, these are the very common questions what we encounter in our OPD. What lens to put? So the lens has to be put. That is the first step I'll be telling, because many a times patient will ask, why do I need those lens? So as I told you, eye is like a camera. So the whatever God has given, those lens have become opacified. So we need something to converge those light rays entering inside the eye. And without any lens, the vision, even if we remove the cataract, the visual clarity is not back. So that's why we introduce a lens. So these lenses, there are many types. We have a monofocal lens and multifocal lens. We have a rigid lens and foldable lens. So rigid and foldable depends on the procedure. What procedure are we doing on the patient? So if we are doing a manual small incision cataract surgery, we prefer rigid lens. In a phacoemulsifications, because the incision size is small, we prefer a foldable lens. It will be folded and it will be introduced inside the eye. So this is usually procedure based, and as I told you, there is one more category, that is monofocal and multifocal. So what is this monofocal? Basically cataract damages your distant vision. So monofocal lens corrects the distant vision only. Patient will have to use spectacles for near vision post-operatively. Whereas a multifocal lens, you can even see the distant vision as well as the near vision. Patient will not be able to decide on this. We will do certain tests on the patient, whether he is what are his needs, what is his presenting age, what are his visual needs, what is his occupation. Based on all these factors, we give them option whether he is a suitable candidate for a monofocal or a multifocal lens.
Even though there are a lot of types of lenses available, the patient doesn't have to actually take the decision on which type of lens
Yes.
has to be
Yes.
used in the cataract surgery. It is based on the doctor's examination findings.
Yes. So we see the different grade of nucleus, and plus some people, for example, they tell, I don't usually go outside, I don't drive, I am okay wearing post-operative spectacles. So those people, we prefer to put a monofocal lens, and they are not right candidates for multifocal. Few tests we do where we get to know they are not right candidates for multifocal lens. So those people we advise with monofocal lenses. So in monofocal lenses, post-operative spectacles will be there.
And one interesting thing is that the cost of the surgery is also going to be based mainly on this intraocular lenses. So it doesn't mean that costlier lens you choose, you are going to have a better vision.
The popular belief among the patients is the more the cost of the lens, the better is the vision. That is absolutely untrue. I will tell the patients that it depends on your retinal status. As I mentioned initially, the light has to finally fall on the retina, and the retina will send the images to the brain, and then the interpretation happens. So if the retina is not healthy at all, for example, the patient has had a diabetic retinopathy or a retinal detachment, or a optic nerve is having some glaucomatous changes, any kind of optic neuropathies, all these people, you put the best possible lens, the most costliest lens you put, the patient will not end up with the best vision. It doesn't mean that a costly lens will give you a better vision. That is a myth among the patients.
So it's better to leave the decision on which lens to be used for the surgery to the doctor.
Definitely. We evaluate the retina in such a manner, along with grading of the nucleus, grading of the cataract. We also examine the retina. If required, we run some tests where we know the retinal status, the macular status, and we know what is the visual potential, exactly what we can expect. We will explain it to the patient, and they themselves can take a decision. Sometimes multiple things coexisting. That is, patient might have a cataract, they also can have a glaucomatous optic atrophy or glaucomatous optic neuropathy. So to improve the quality of vision, maybe to give some amount of vision, we will advise cataract surgery. But at the same time, we will not tell them that you will get complete vision, because the retinal status is not so good. We would have beforehand explained to the patient that your vision experience will be limited because of the retinal problem.
Okay, so when you screen a cataract patient, you just don't only look at the lens. You look at the general eye condition along with the retinal status, so that you can take the decision regarding what surgery treatment is best for the patient.
Yes.
Okay. So the patients might be presenting to you mostly when both the eyes are affected, right? Because when both the eyes get affected, the complete vision, quality of vision will get compromised. So in that case, if a patient asks you that I want to get both the eyes operated at a time, what will be your advice?
So again, we grade the nucleus. Suppose they are of the equal grade. It's the patient's choice which eye they want to get operated first. And many times they tell do it simultaneously. We would never advise that, because post-operative care becomes difficult. Putting drops and the utmost care what you have to give, maintaining both eyes is like maintaining two kids. So it will be difficult simultaneously. So what we do is we operate one eye, we wait for at least 7 days, we examine the operated eye, and then we ask them to come after a week. If they have to urgently get the second eye done, in our hospital, we recommend at least 15 days of break between the two eyes. After that, sequentially, anytime they can get it done.
Okay, so it's always better, another analogy here, having both two kids. So it is very difficult to manage. So it's always better to have a minimum gap of 1 week between the two eyes getting surgery.
Yes.
When it comes to surgical treatment, cost is always a concern. So what about cataract surgery? Is it covered under insurance? Or if a person is not having insurance, what is the cost range? What will be the minimum and how much it can range up to?
It is definitely covered under insurance. Up to 35 to 40,000 is covered for one eye. So everything, the lens, everything is coming under the insurance. Suppose the patient doesn't have a insurance, in our hospital we have made it so affordable for everybody. The cataract surgery cost starts from 2,500 to 10,000.
So now that is assuring as well, because cataract surgery is covered under the insurance.
We also have certain national programs where they conduct camp on the behalf of government, so that we reach the innermost areas, the rural areas, and they also can utilize these services. So even in camp, in a large scale, a lot of surgeries happen, and they are also totally safe and effective.
Is the surgery that you do in hospitals and that is done in the camps different?
So now the protocol is, anywhere we screen the patients, we have to get them to a hospital setup. We do not operate in a peripheral setup only for the belief that there is a higher risk of infection. Our eye is a very sensitive structure. It can easily get infected. We don't want such a infective catastrophe to happen. So we just screen the patients in a rural periphery, and then we bring them to the center. Then we operate in our OT setting itself, so that the aseptic precautions are taken care of, and infection rate is 0.
Okay, so there is no difference. Now all the surgeries are happening in the hospitals.
Yes.
In the camp setting, what is happening is just the screening or the eye examination by the ophthalmologist.
Yes, we just basically educate them in their setting, and then we bring them. We put a date for the surgery. We bring them to the center. We assess them. We grade the nucleus, and we do a blood investigations, minimal basic blood investigations. We see if they are fit for cataract surgery or no, and then we take them to the OT here itself. After the surgery, we keep them for 1 day, so that going back and coming is a risky thing in those cases. So we keep them in the hospital. Again, we examine them, and then the second and third examination, we go to their place basically, and then we examine there itself. Again, the patient need not come for spectacles. That also will be taken care of by our optometrist. They go to their places and issue the spectacles at the end of 1 month.
Other question that we commonly address is that what about the surgeries done under the insurance coverage and other paid procedure? What is the gross difference in the numbers that you already quoted? Why is it? Is it the IOL price that is different, or is there any other factor that is contributing to the costing part?
The lens what we choose, like I told you, there is multifocal, there is trifocal, there is monofocal. So based on that itself, you don't get a multifocal at a cost of around 5,000, 6,000. It is very rare. So the multifocal is of a higher price range, and the procedure almost everywhere it's the same cost. But depending on the lens, the insurance coverage changes. So up to 35 to 40, in that around 20 to 30, the lens cost will be there.
Okay, but in insurance coverage, intraocular lens is also included.
Yes, it is included. Again, some people force us to put a higher lens because they have an insurance coverage. Again, I would like to reiterate that it is the need of the patient rather than what is the highest range of the lens. Whatever lens we put, it doesn't mean that the visual clarity is too good. No, definitely no. All the lenses are manufactured in the same way, in the same range. Only thing is the types are different. I cannot put a rigid lens into a phacoemulsification. Depending on the procedure and everything, we doctors decide these lenses are good, these lenses are suitable for the particular patient.
So as we emphasized before also, the decision on which lens is ideal for the patient, leave it to doctor. Discuss with the doctor and take a combined decision.
Yes, we give options. because a few options are totally not fitting to everybody. So we give them options and choose among the options. Depending on your financial status, the insurance status, you can take a call.
Another one common belief in the community is that cataract surgery should not be done in winters because there is a very slow healing that happens in winter. What about that? Is there any fact in this belief?
No, this is a myth which even I have encountered. Most of the patients, they do not come to the surgery in the month of November or December. They think winter, there is lot of air, wind, and that itself will delay the healing. And I would suggest them to come anytime they feel, because this seasonal variations has very minimal effect on the surgery. The healing is as good as whenever you get it done. Even in the summer, the healing is the same. So it is a myth.
So surgical healing doesn't depend on the seasons.
No.
Okay. So delaying the surgery just for the summers is not a good option.
Yes, it will only cause further reduction in your quality of life. You will have to again wait a few months only for that, which is like totally untrue. You can get it done even in winters.
One common concern, Dr. Spurti, among the cataract patients is that when they diagnose themselves as having cataract, is surgery immediately needed, or is it that they can use spectacles for some time and then time their surgery accordingly?
Definitely. You can postpone the surgery depending on the grade of the cataract. Now it's a smaller grade cataract where cataract is there, but you can also get back some amount of 1 or 2 lines of vision with the spectacles. We can advise the patient with spectacles. That only will delay the surgery, but by around 2 to 3 months. But eventually, after 3 to 6 months, once the cataract stages progress, then he or she has to go for surgery. But definitely, it is not like the moment we diagnose cataract, we need to straight away go for the operation theater. We can even wait, and we can give the spectacles. We'll see how much the patient is accepting the spectacles, and then depending on the doctor's decision, we can take it slowly also. And plus, it is a buying time for people who have, suppose the patient has an uncontrolled diabetes, patient has an uncontrolled BP, or there is some cardiac disease which needs more care. Right now he is not able to get the surgery done. So to postpone to buy time, if the nucleus grading is smaller, then we can try with the spectacles for a few days. But eventually, after 3 to 6 months, surgery has to be done.
Once a person is diagnosed of cataract, immediate surgery is not required.
Yes.
According to what your doctor suggests, but you can, with the spectacles, delay the surgery and time it according to your convenience as well.
Yes.
And it's a boon for those people who are having diabetes or any other comorbidity. They get some time to control that disease condition as well.
Yes.
Okay. So since this is a disease that is invariably going to affect any people at any point, at some point of time, is there any preventive strategies that are there to prevent cataract or at least delay the onset of cataract?
Like I previously mentioned, like graying of hairs, you cannot prevent it. A wrinkling of your skin, you cannot prevent it. Same way, you cannot prevent the formation of cataract. It can be in any age, after 60, after 70. So at different point of time, we need to only take care about the food habits, the lifestyle modifications, regular. Better to use complex carbs, and have a moderate to severe exercise, and modify the lifestyle accordingly. Eat lot of complex sugars, and take proteins regularly. But you cannot prevent the formation of cataract. It will happen. If you are alive till the age, it will happen. So we'll just do as we are maintaining our other lifestyle. So for other purposes, this also can be easily maintained. But see to it that whether you have any symptoms or no, I would suggest go to your ophthalmologist regularly, at least yearly once. And even whether symptoms are there or no, get a regular eye checkup. So many times patient will be afraid of going to ophthalmologist in the fear that I have cataract. So that is not the thing. So there are overall comprehensive eye examination after the age of 50. Yearly eye examination is a must.
Okay, so since it's a part of aging, it cannot be prevented.
No.
But the other lifestyle factors like diet, like sedentary lifestyle, if it is taken care of, might be the progression can be delayed.
Yes.
And early diagnosis.
Correct.
With the consultation from an ophthalmologist, with a simple eye screening is the key.
Yes.
Thank you, Dr. Spurti. It was a very informative discussion, and we are privileged to have you with us in Aarogya Vani.
Thank you, Dr. Anu. I am happy that you invited me and you gave me an opportunity to spread the awareness among the public. Cataract is a curable disease, easily curable disease, and with the help of a simple, convenient surgery. Do not procrastinate your eye examination. Do not procrastinate your eye surgery. It is totally safe and you can enjoy unlimited good vision overall life. Thank you.
Thank you. So, dear listeners, don't ignore the change in your vision. A very simple eye examination by the ophthalmologist can find you the cause for your vision loss. And now you know that cataract surgery is a very safe, effective and convenient procedure. With this, we have come to the end of this episode of BGSMCH Aarogya Vani. If you find this video informative, please do like our video and share with your loved ones. If you have any doubts regarding this topic, please comment below. Stay healthy, stay informed. Until next time, this is your host, Dr. Anu, signing off. Jai Shri Gurudev.
If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and hit that subscribe button for more exciting content.